Here's what to expect after a meniscus repair surgery. My name's Dr. Eric Broadworth. I am a doctor of physical therapy, orthopedic clinical specialist, and I am the CEO of Fuel Health and Wellness in Grand Rapids, Michigan, where we help active adults and athletes recover from injuries and return to the sports and activities that they love. So, I'm going to go over what to expect after a meniscus repair surgery. So if you're watching this and you're about to have surgery, this is going to be a great video for you. Or if you know someone that's about to go through a meniscus repair surgery, you're going to want to share this video with them. If you have any comments, questions, anything like that, please put them in the comments below. Happy to answer those for you. So with the meniscus repair surgery, oftentimes with this specific one, they're going to try and save as much of the meniscus as possible, as long as that portion of the meniscus is able to heal, that has blood flow to the area. They can suture it and fixate it so that way you don't have that flap that's causing all of the pain and the catching and the instability in the knee. So with this, you're going to likely be on crutches and off of that extremity after the surgery for a period of time. So you may be either non-weight bearing or partial weight bearing and having to use crutches for even up to 6 weeks afterwards. So just a heads up there, it will take up to 6 weeks likely to get rid of then your crutches. You're going to want to check with your surgeon specifically and ask them those questions. Now, after the surgery, there is probably going to be a little bit of pain, but it will be controlled with pain medication and with ice. And usually it's not that bad. So if you're worrying that the pain's going to be intolerable, let your surgeon know those concerns. But typically, you're going to find that you're going to do really well, especially if you've been active before. You're going to heal just well. So again, if you're worried about the pain, talk with your surgeon about that, about the pain medication. You'll often be prescribed pain medication, and the worst days with regards to pain after the surgery are usually days 3 and 4. That's when the inflammation is the most afterwards with the trauma from the incision that they made and when they went into the body to repair the tissue. And after that, that inflammation starts to come down and the pain really starts to alleviate, and you can get off any pain medication. To help control pain and inflammation too, they're also going to recommend likely that you ice and elevate that leg after surgery. So you can get an ice bag, an ice pack, and what's really nice, if you can get the ice compression machines that they have out there, those are really nice to help with some of that pain and swelling. And my patients have found that they really like those. So ask about any type of ice machine to your surgeon that can be helpful. Now, one of the things that I highly recommend that we have here at Fuel Health and Wellness to help speed up healing is a class 4 laser, and using laser therapy and red light therapy to help speed up the tissue healing. So I'll actually have people come in before a surgery. We'll do a laser session to help prepare the body for surgery. And then after surgery, during their rehabilitation, we're doing laser to help speed up healing. And if you're interested in that, we've got some different videos on how laser therapy works. So feel free to ask any questions in the comments below or check out our website on that. After surgery, they're also likely going to recommend that you do physical therapy, which is going to be super important. Physical therapy is going to help with the pain. It's going to help with the range of motion. It's going to help with the strengthening and returning of the strength to those muscles around the knee, the hip, the ankle, and then returning to sport. So if you're an athlete and you're wondering, hey, when am I going to be able to return to my sport? You do need to understand that it is going to take time, and you do need to be patient and work with your physical therapist and your surgeon and be diligent about your exercise and your rehab protocol. And also inquire about nutrition. And if you're wondering what to do about nutrition, check in the description. I have a whole blog on nutrition after a surgery. So when to return to sport? You're going to be off of crutches typically around the 6 weeks. And then after that, you're getting your walking back. Again, we're getting range of motion, strength back. And then around 6 months, mark, we're getting back to some sport type activities in a controlled manner. Um, and even before that, around 12 to 15 weeks, that 3 month mark, you're getting into plyometrics, meaning jogging, running, light jumping, and gradually progressing. But when it comes to return to full sport and being released to playing games and competitions and things like that, it's often around the 9 month, even possibly 12-month mark. You want to make sure that you have a limb symmetry index of 90%, meaning your left and your right uh, leg are 90% symmetrical to return to sport. And there's different tests that you can do with your physical therapist to determine that and whether you are appropriate to return to sport. So that's really what to expect after a meniscus repair surgery. If you're going through the surgery, good luck with your surgery. Wish you the best and hope you heal quickly and heal fully. If you have any questions, please put them in the comments below. And we look forward to seeing you return to your sport.